Hi, there is an assumption that people infected with COVID-19 with mild symptoms or without symptoms have the virus, and so they can transmit the virus to surrounding people. And this is just an assumption. There's no any solid report or scientific study to prove it. So today, this paper published in Nature, and which show that indeed people infected with COVID-19 with mild symptoms have a very high virus replication in the upper respiratory tract. So thus the virus can be shed into the environment and can transmit to the people surrounding. And the studies were designed and they use advanced technology, and all the technology was qualified. I think the conclusion is solid. Let's just look at one data to show that, to prove that the virus is really existed in the upper respiratory tract, thus may have potential to transmit the virus. And the other actually select 9 patients. So in this result from 9 patients, and each small picture is the result from 1 patient. And in this 1 patient, the x-axis is day they enroll into this hospital. In the y-axis is the concentration of virus. The higher the number, the more virus. And the yellow line means the sample collected from the nasal swab. And the red line is sample collected from sputum. And you can see that in the first week, in patient's nasal swab, you can still identify this virus. So about 1 week, 7 to 10 days, you can easily identify virus in nasal, in patient nose, or in upper respiratory tract. That means this virus there, this potential that the virus can be spread to people surrounding you. And you should point out that when they get in the hospital, the virus already very high. Before come to the hospital, they already have a high concentration of virus. They can spread this virus to the surrounding. And that's again that in nasal swab, in all the cases that in the first week they get into hospital and they all have virus. And in the red line, sputums, and during this patient, during the entire process, they stay in the hospital, even they get out of the hospital. In this line, that means to get out of the hospital. They still have virus in the sputum. That means the patient still have potential by cough. They can get virus in the environment, thus transmit the virus to the surrounding people. And what this result does prove that, and the people, actually all the people actually have with their mind or without symptoms, they have virus in this upper respiratory tract, or in sputums. Maybe sputums come from this lower respiratory tract. And what is important is that in the sample from the sputums, even after about 20 days, or it discharged from the hospital, and the virus still have virus. And nowadays that the resource in the hospital is very, very limited. It means that usually people in, like all the 9 patients that shouldn't be in the hospital because the symptoms is mild, and there are not of patient which has much severe than this patient. So that means when this patient is discharged from the hospital, and when they cough, they still can get out of not a virus. So this is really challenge. And so even so, we suggest from this study even so the discharge from the hospital, they still need to isolate them for at least sometimes at least 2 weeks. You can see very clear that even the discharge from the hospital, in the sputum, they still have the virus. So this study will clearly indicate that the patient infected with COVID-19 with mild symptoms or without symptoms, very clear that the virus is replicated in the upper respiratory tract or the entire respiratory tract, and thus indicate that they can spread the virus to the surrounding, to the environment, and thus there is the potential to infect other people. And this is very scientifically proved that. And COVID-19 patient which with mild symptoms or without symptoms, they can shed the virus into the environment. So that we really need to be very careful. The people need really, if you have any symptoms without symptoms, they can spread the virus. So the social isolation or social distancing, self-isolation and quarantine is very, very important for us to stop the spread of the virus. And that's my thought for today. I wish to see you in my next video. Bye.